Rachel, what do you attribute your success of doing so many PAPs on women in your panel to?
My medical assistant, Jessie, who sets up pap smears for any woman who's due. She knows that it's fine with me, and so before I even see the patient, she finds out if they've had a pap in the last 3 years or the last 5 years, depending on their age, what the result is. She has them get undressed before I go into the room so that when I walk in, it's really easy for me to do a pap.
Do you think it matters that she knows that you are never going to complain about the fact that the woman needs a pap?
Well, I do complain. She tells me to stop complaining and just do it.
And
Plus,
then
we
you
want
listen.
to keep our golden speculum.
Right. Okay, so tell me about the patient you had the other day, who was a new patient.
The other day, 24-year-old new patient came in. She was trying to get pregnant, but that wasn't the reason she was in to see me. I think she'd been in the ER for a headache, and she was following up, and her headache was mostly gone, but wanted to establish care. Jessie set her up for a pap smear. We sprung it on her. The patient was surprised, but she actually ended up having a normal pap smear, but trichomonas and chlamydia, which we caught. The other reason I think is that I'm seeing a lot of new patients. I think I have 4 a day, 5, maybe 5 a day on my schedule. The biggest demographic that we're seeing right now is women of pap smear age, around 24, and so many of them will come in, and oftentimes they've never had a pap smear, and we'll do the pap smear on their first visit.
The thing that I think helps the most getting women to agree is you kind of have to convince them and giving them the actual numbers that it can be, if it comes back normal, between 3 to 5 years before they have to repeat it, works pretty well because most of them don't know that and they think it's still going to have to be a yearly thing. If you let them know that it's not, then they're a little bit more inclined to get it done and just get it out of the way since they're here. That important, I set it up because I would always have it set up before I room the patient, and if it turns out they don't need it or they are declining it, then you just put it away.
Okay. And do you have any good stories about somebody that you guys convinced to do a pap smear that turned out to be like a really good thing for them?
We have a lady who was, I believe, in her 50s, had never had a pap smear before. Rachel actually had to refer her off because she couldn't even see her cervix, but there was a polyp-like growth coming out of her cervix that was really long, and it ended up being cervical cancer.
Oh, and she wouldn't have caught that except that you guys decided you were going to do a pap on her.
She wouldn't have caught it. I don't know what the results are now because Dr. DeKaiser ended up seeing the patient, but it was obviously far advanced.
Wow.